Welcome to Table Talk, Talks, Transparency, and Togetherness. Today, we're excited to have our lead nurse for the district, Karen Scruggs. Thank you for being with us today, Nurse Scruggs.
Thank you for asking.
Well, Nurse Scruggs, I just want to first thank you and our district nurses for all of your work that you have done as we transition through this pandemic. Your leadership has been phenomenal. Our nurses across the district have been very responsive and attentive to the needs of students as well as staff. So again, I just want to say thank you for a job well done. Well, this morning, of course, we know health and safety is on the minds of all of our stakeholders. And we just want to assure our families that we do have systems, protocols, and procedures in place that support the well-being of students that may have COVID issues, they may be dealing with other issues within the school setting. So this morning, we just want to focus a little bit on the pandemic and how we're handling COVID situations in Marion County School District. With that being stated, can you just explain some of the health and safety regulations that we do have in place and some of the regulations that come down from DHEC and how our district administers those regulations or adheres to those regulations?
Yes. Well, in our schools, we are practicing social distancing, and our students that are in the classroom for the hybrid model are, their desks are separated by at least 6 feet. They're also wearing masks in the classrooms and in the hallway while they're at school. Everyone wears masks, the students, the teachers, all administration, the nurses. And we also have the plexiglass on the desk for the students as another barrier between the students themselves and the students and the teachers.
Awesome, thank you. Now, in terms of exposures, can you talk a little bit about an exposure? If there is an exposure, notifications, I do know that there may be some misunderstanding or clarity needed in regards to if there is a positive case that it comes from a family connection or a home and that child has been to the school. How do we handle those notifications, and talk about the work that you do with DHEC?
Okay. Each school in the district has a DHEC nurse. So when we are notified from a parent, then we call our DHEC nurse and make sure that she has been notified. Lots of times she is notified first, and then she will contact that school nurse. And if there is a positive case in the school, then again, they let us know, and then we start looking at any contacts that this child has come into contact with, any classmates, teachers, whoever. And then we look at the risk involved there with the contact, and we begin making notifications only to the children and staff who have been in contact with the positive student or staff. We do not notify everyone in the school. There is no need. You cannot become infected with the virus from being in close contact with someone who has been in contact with the positive student. In other words, the disease is only transmitted from the positive student or staff, not from someone who has been in contact. So you are not at risk from being in contact with a contact. Does that make sense?
That does. In essence, you have to say that you're saying that the contact has to be directly with the carrier of the virus.
Exactly. To be at risk for exposure.
And also to make sure our stakeholders realize that letters are sent out if their first contacts are made in terms of phone calls, getting in contact with parents, but then also letters are sent. Can you talk about a little bit about those letters that are sent? And those are DHEC letters. Those are not letters that Marion County School District that we've drafted.
Right. These are DHEC letters. The DHEC letters state how long the quarantine for that student. And it's a 14-day quarantine. They give the exact date that the child can return back to school. It also gives the symptoms for this child to look for. It also states that the child may be tested 7 days after exposure. We don't want the children to be tested before that 7 days because that's when you get false negatives. But at least 7 days after exposure, we encourage the child to be tested and then to continue that 14-day quarantine. That
So
is
Nurse Scruggs. Oh, go ahead. I'm sorry.
all stated in the letter that goes home with the student.
Absolutely. And so just to be clear, and I'm glad that you brought up that point, so often when people hear of a positive case, and if they've had any interaction with that person, their first thought is, I need to go immediately and get tested. But what you're saying and what our DHEC at the state level is saying too, in many of my superintendent's meetings, is that if you go too soon to be tested, you can get a false negative. You need time for that virus to, in essence, get in your system so that it can register with the test. And so testing too early is not a benefit at all.
That is correct.
Okay.
That is correct.
And I do understand, everybody's anxious about this. And the first thing, I need to know. But it needs to be in the right amount of time to be able to make sure that your test is accurate. That is so important. Now, can you talk a little bit about, we're excited. I updated our board last night that we have formed a new partnership with MUSC in regards to testing. Can you give the details of that as well as talk about those testing sites?
Sure. We have entered into partnership, like you said, with MUSC in Marion and Florence. The hours for testing at the Marion Hospital is Monday through Friday from 8 a.m. to 10 a.m. And in Florence is Monday through Friday until 5 p.m. So if you can't be tested at the Marion facility, you can go to the Florence MUSC for testing. The results are anywhere from 24 to 48 hours are available at that time. And you can take a form from the school nurse that she has, or you can go and just say that you are a staff of Marion County School District or a student of Marion County School District or a family member of a student of Marion County School District and be tested for free. And just at those facilities during those times, and we encourage you to do that.
Okay. And Nurse Scruggs, when you're talking about this testing, I do think that when you utilize the district's partnership for testing, you do have to sign something to say that those test results will be released back to the district, and that information is confidential and it goes straight back to you as our lead nurse.
Exactly. It is a release form, and I will get the results from MUSC for the staff or the student who is tested.
And am I correct in stating too that our partnership with DHEC has been extremely good? And I do think if DHEC is aware that a case has a connectivity to the school district, they are also in communication with us as well.
Absolutely. They have been wonderful to work with. Our nurse, Sarah Mormon, has just done a remarkable job of assisting and guiding the school nurses in what we need to do to follow the protocol that has been set.
Absolutely. Well, Nurse Scruggs, this has been very helpful. One last topic that I want to talk about, several principals have reached out to me, just concerns, very upset parents regarding immunizations, and especially more specifically with that 7th grade DTaP. Is it DTaP?
TDAP.
And I just want to, and I'll let you explain, but I just want to say, just as superintendent, that with immunization, that is state law in terms of, in order for your child to come to school, be enrolled in school, let me rephrase that, to be enrolled in school, your child has to be immunized. And what I mean by that, even if you have opted to do virtual academy and your child is remote, they are still enrolled in Marion County School District. Therefore, parents, you have to have proper immunization. And so, Nurse Scruggs, I didn't know if you needed to say any more on that, or any assistance you can provide, because we do have several families there that had the thought that because my child is virtual, I didn't have to keep up with my shots. It is state law. You must keep up with your shots. And unfortunately, our school nurses have to enforce the rules and regulations. And so just want to be very clear. So Nurse Scruggs.
Yes, that is correct. The key word there is enrolled. So whether you're enrolled as a virtual student or you're enrolled as a hybrid student, you still have to comply with the state law for immunizations for all students. So they have required vaccines for certain grade levels. And the Tdap is the required vaccine for rising 7th graders. So those students, whether they're virtual or whether they're hybrid, have to meet those requirements according to state law.
Absolutely. Thank you, Nurse Scruggs. Well, listen, the information that you shared has been so helpful today. Was there anything else that I did not mention that you wish to share that may be a benefit to our families in regards to health and safety protocols?
Well, I do have one more announcement that I would like to share, and that is the flu clinic DHEC will be having this Saturday, October the 24th, and it is a drive-up flu clinic at Mullins High School, and they will be there from 10 a.m. to 3 p.m. There is no charge for the flu vaccine, but it's only for all school children.
Okay.
That's this Saturday.
This Saturday in the parking lot of Mullins High School, a drive-up flu clinic. And again, Nurse Scruggs, thank you for your partnership, and one, for making sure that as a district that we are following the appropriate protocols for health and safety. Stakeholders, parents, if you have additional questions, please do not hesitate to reach out to Nurse Scruggs. She's our lead nurse for the district, but any of your school nurses should be able to properly answer your questions or any concerns or problems that you have. They may be able to address those. But anyway, we want to thank you, Nurse Scruggs, thank your team, thank you parents for your patience during this entire process. As a side note, nothing to do with health and safety, but I do want to announce that we will start distributing devices to our students that are not in virtual academy. So every child in Marion County School District will be offered a device. I do know there are some families that have their own devices. They opt not to take a district device, but every child in Marion County School District does qualify or is able to get a device if they opt to. Thank you again for watching Table Talk. Hopefully this information has been helpful. Have a wonderful day.